Dorothy Williams smoothed her church dress one final time before stepping into Mount Olive Baptist's Fellowship Hall. At 73, she moved with the practiced grace of a woman who'd navigated 7 decades of Sunday morning rituals, her pearl necklace catching the fluorescent light as she adjusted the casserole dish in her hands. The monthly church supper buzzed around her familiar voices, discussing grandchildren medications and the latest neighborhood drama. "Sister Dorothy," called out Deacon Matthews, waving her toward the serving table. "That sweet potato casserole better be your grandmother's recipe." She nodded, managing a smile despite the heaviness that had settled in her chest since Marcus's funeral 3 months ago. 48 years of marriage, and now she was learning to navigate these gatherings alone. The church ladies meant well with their constant invitations and gentle hovering, but their pity felt like a wool blanket in July, suffocating, despite good intentions. Dorothy was arranging her dish next to Sister Johnson's cornbread when her phone buzzed against her hip. The Medicare app notification glowed insistently, "Important account update available." She frowned. Marcus had always handled their medical bills with the meticulous attention he'd once brought to his job at the post office. Since his passing, she'd been slowly taking over these responsibilities, learning to navigate a digital world that seemed designed to confuse people her age. She stepped into the quiet hallway outside the fellowship hall and opened the app. The screen displayed their account summary, but something was wrong. According to the records, Marcus had received extensive physical therapy treatments at a facility across town, treatments that supposedly continued for 2 weeks after his funeral. Dorothy's hand trembled as she scrolled through the itemized charges. Therapeutic massage, hydrotherapy sessions, equipment rentals, all dated after March 15th, the day they'd lowered Marcus into the ground at Greenwood Cemetery. "Sister Dorothy, you all right?" Sister Johnson appeared beside her, concern creasing her brown face. "You look like you seen a ghost." "I'm fine." Dorothy lied, quickly closing the phone. But her mind was racing. Medicare fraud wasn't uncommon. She'd heard the warnings on the news, but seeing her late husband's name attached to phantom treatments felt like a violation of his memory, a desecration of their shared life. She excused herself early, claiming fatigue, and drove home through the familiar streets of her Atlanta neighborhood. The house felt enormous without Marcus's presence, his absence echoing in every room. She settled at the kitchen table with a cup of sweet tea and reopened the Medicare app, this time taking screenshots of every fraudulent charge. The physical therapy facility was called Complete Care Rehabilitation. She'd never heard of it, despite Marcus's numerous legitimate medical appointments in his final months. A quick Google search revealed an address in a strip mall near the airport, hardly the kind of place Marcus would have trusted with his care. Dorothy pulled out the manila folder where she kept all of Marcus's medical records. Her late husband had been methodical about paperwork, a trait that had sometimes frustrated her, but now proved invaluable. She cross-referenced the legitimate appointments with the fraudulent ones on her phone. The pattern became clear. Someone had been using Marcus's Medicare information to bill for services he'd never received at a facility he'd never visited. Her landline rang, startling her from her investigation. The caller ID showed Complete Care Rehab. "Mrs. Williams." The voice was young professional with an accent she couldn't quite place. "This is Jennifer from Complete Care Rehabilitation. I'm calling to confirm your husband's appointment tomorrow at 2 p.m. Dorothy's blood chilled. "My husband passed away 3 months ago." Silence stretched across the line. Then, "Oh my goodness, I'm so sorry for your loss. There must be some mistake in our system. Let me transfer you to our billing department to get this sorted out." "Wait!" But the line had already gone quiet, replaced by generic hold music. Dorothy hung up and immediately called the number back. It went straight to voicemail. "You've reached Complete Care Rehabilitation. Our office hours are Monday through Friday, 9 to 5. Please leave a message, and we'll return your call within 24 hours. She glanced at the clock. It was barely past 6 on a Sunday evening, yet someone had just called her from a facility that claimed to be closed. Dorothy had spent enough years working as a secretary at the county courthouse to recognize something fishy when she saw it. Opening her laptop, a recent purchase she'd made, to stay connected with her grandchildren, she searched for Complete Care Rehabilitation's website. The site looked professional enough with stock photos of smiling elderly patients and gleaming therapy equipment. But when she clicked on the About Our Staff section, all the photos were generic, watermarked images from a medical supply company. Dorothy dug deeper, searching for reviews, complaints, anything that might tell her more about this facility. What she found made her stomach turn. Complete Care. Rehabilitation had dozens of complaints filed with the Better Business Bureau, most from families discovering fraudulent charges after their loved ones had died. She was printing out the complaints when her phone rang again. This time, the caller ID showed her daughter-in-law Keisha's number. "Mama Dorothy." Keisha's voice sounded strained. "I just got off the phone with someone from Marcus's old Medicare provider. They said there might be some irregular activity on his account, something about therapy appointments." Dorothy's throat tightened. "When did they call you?" "About an hour ago. They wanted to verify some recent charges, but Mama Dorothy, the way the woman was asking questions, it didn't sound right." She knew too much about Marcus's medical history, things that wouldn't be in basic records. What kind of things? His birth date, social security number, even the hospital where he had his last surgery. But then she asked about his current address like she expected him to still be alive. When I told her he'd passed, she seemed genuinely surprised. Dorothy sank into her chair. The Medicare fraud was bad enough, but if someone had access to Marcus's detailed medical information, this was bigger than simple billing theft. Someone with inside access was orchestrating this someone who knew enough about the system to make the fraud look legitimate. "Keisha, I need you to come over. Bring Jerome too. We need to talk." An hour later, Dorothy sat across from her son Jerome and daughter-in-law Keisha in the same kitchen where she'd shared countless family meals with Marcus. Jerome, a software engineer who'd inherited his father's methodical nature, was scrolling through the Medicare charges on his tablet while Keisha took notes. "Mama, this is sophisticated," Jerome said, his voice tight with anger. "Whoever's doing this has access to detailed medical records, insurance information, maybe even Social Security databases. This isn't some random scammer calling elderly people." "The timing bothers me," Keisha added. "Why would they continue using Daddy's information after he died? Any legitimate facility would have been notified by Medicare or the hospital." Dorothy had been wondering the same thing. Unless they didn't expect anyone to be watching the account this closely. Jerome looked up from the tablet. "What do you mean? Think about it. How many widows my age actively monitor their late husband's Medicare accounts? Most people my generation, we trusted the system. We assumed if Medicare was paying for something, it must be legitimate." Dorothy's voice grew steadier as her anger crystallized into purpose. "Whoever's behind this, they're counting on grieving families being too overwhelmed to notice extra charges." "So what do we do?" Keisha asked. Dorothy stood and walked to the window, looking out at the street where she and Marcus had built their life together. 48 years of hard work, careful saving, and following the rules. Marcus had served his country in Vietnam, worked 30 years for the Postal Service, and paid into Medicare every week of his working life. Now someone was stealing from his memory, profiting from his death. She turned back to her family, her jaw set with determination that reminded Jerome of his father. "We're going to expose them, all of them, but we're going to be smart about it." "Mama, maybe we should just report this to Medicare fraud investigators and let them handle it," Jerome suggested. "Baby, you know how slow government moves. Meanwhile, they're probably doing this to dozens of other families, stealing from people who can't fight back." Dorothy moved to the kitchen drawer where Marcus had kept his important papers. She pulled out a small digital recorder he'd used for union meetings. "Your daddy didn't raise a woman who backs down from a fight. especially when it's about doing what's right. Keisha and Jerome exchanged glances. They both recognized that look, the same steely determination that had gotten Dorothy through segregation, through raising a family on one income, through Marcus's long illness. "What do you need us to do?" Keisha asked quietly. Dorothy smiled, the first genuine smile she'd felt since the funeral. "First, we're going to find out exactly who's behind Complete Care Rehabilitation. Then we're going to make sure they never steal from another grieving family again." She looked around the kitchen table at her son and daughter-in-law, the family she and Marcus had built together. "And we're going to do it the right way, with evidence, with documentation, and with the kind of patience that outlasts whatever tricks they think they can pull on an old black woman from Atlanta." The war for justice was about to begin. Monday morning found Dorothy at the Fulton County Health Department, armed with a manila folder thick with printed Medicare statements and a small notebook she'd bought specifically for this investigation. The waiting room buzzed with the familiar sounds of Atlanta's working, poor, crying babies, hushed conversations in multiple languages, and the occasional sharp voice of someone arguing with a clerk about paperwork. Dorothy had dressed carefully for this mission. Her navy blue suit from Macy's, the one she wore to church board meetings, paired with sensible shoes, and her late mother's pearl earrings. She'd learned long ago that looking respectable opened doors that might otherwise remain closed to a black woman asking pointed questions. "Next," called the clerk at window 3. Dorothy approached with the practiced patience of someone who'd spent decades navigating bureaucracy. "Good morning. I need to report suspected Medicare fraud involving my late husband's account." The young woman behind the plexiglass barrier looked up from her computer screen with barely concealed irritation. "Medicare fraud reports need to go through the federal hotline, ma'am. We don't handle that here." "I understand that," Dorothy replied smoothly. "But the facility in question is operating here in Fulton County. I need to verify their business license and see if there have been other complaints." The clerk's expression shifted slightly. Dorothy had struck the right tone, not demanding, not angry, just a concerned citizen seeking information that was rightfully public. 20 minutes later, Dorothy sat in her car outside the health department reviewing the documents she'd obtained. Complete Care Rehabilitation held a valid business license issued just 8 months ago. The registered owner was listed as Pinnacle Health Management, LLC, with an address that matched the strip mall location she'd found online. Her next stop was the Atlanta Police Department's white-collar crime division. Detective Maria Santos, a woman in her 40s with kind eyes and graying temples, listened patiently as Dorothy explained the situation. "Mrs. Williams, what you're describing sounds like a sophisticated operation," Detective Santos said, making notes in her file. "The fact that they're still using your husband's information months after his death suggests they have access to real-time medical databases." "What does that mean?" "It means this probably isn't just one rogue facility. Someone with legitimate access to Medicare systems is feeding them information. Maybe someone who works for an insurance company, a hospital billing department, or even Medicare itself." Dorothy felt a chill run down her spine. How many other families might be affected? Hard to say without a full investigation. But Mrs. Williams, I have to be honest with you, these cases can take months or even years to resolve. The federal agencies move slowly, and proving fraud requires extensive documentation. Dorothy leaned forward in her chair. "Detective, I'm 73 years old. I don't have years to wait for justice. What can I do to help move this along?" Detective Santos studied her for a moment. "Unofficially, if you were to visit this complete care facility and document what you find with proper backup, of course it might help us build a stronger case." That afternoon, Dorothy called her nephew Robert, a journalist for the Atlanta Journal-Constitution, who'd inherited the family gene for asking uncomfortable questions. Within an hour, he was sitting in her living room recording equipment spread across her coffee table. "Aunt Dorothy, this is exactly the kind of story that needs to be told," Robert said, adjusting his digital recorder. "Elder fraud is epidemic, but it's invisible because the victims are often too embarrassed to speak up or too overwhelmed to fight back." "I'm not embarrassed," Dorothy said firmly. I'm angry. They're stealing from dead people, Robert, from families who are already grieving. What do you need from me? I want to visit this facility tomorrow. I need someone with me who knows how to document evidence properly. Robert nodded. I can do that. But Aunt Dorothy, if this is as sophisticated as it sounds, we need to be careful. These people have already demonstrated they're willing to commit serious crimes. Tuesday morning, Dorothy and Robert drove through Atlanta's morning traffic toward the strip mall housing Complete Care Rehabilitation. The facility sat between a tax preparation service and a discount beauty supply store, its windows covered with printed signs advertising comprehensive physical therapy and Medicare accepted. Stay close to me, Dorothy murmured as they approached the entrance. But let me do the talking. The waiting room was shabby but clean, with a handful of elderly patients sitting in mismatched chairs. A young woman at the front desk looked up as they entered, her smile professional but strained. Good morning. Are you here for an appointment? Dorothy smiled warmly. I hope so, dear. My doctor referred me for physical therapy after my hip surgery. Do you take Medicare? Of course. Let me get you some paperwork to fill out. While Dorothy completed the forms using false information, Robert discreetly photographed the facility's interior. The equipment looked legitimate enough, though some of it appeared unused. More telling were the patient charts he glimpsed behind the desk, dozens of them all bearing the same handwriting. Mrs. Johnson, the receptionist read from Dorothy's fake form. I see you're 73. Have you had physical therapy before? Oh, yes, honey. My late husband Marcus had quite a bit of therapy before he passed. In fact, I think he might have come here. Marcus Williams. He would have been here just a few months ago. The receptionist's face went carefully blank. I don't recall that name, but we see so many patients. Let me check our system. She typed rapidly, her eyes scanning the screen. I'm sorry, Mrs. Johnson, but I don't show any record of a Marcus Williams. Dorothy nodded sympathetically. Oh, that's all right. These computer systems can be so confusing. I just know he had such good things to say about his therapy here. As they left the facility, Robert was already reviewing the photos on his camera. Aunt Dorothy, did you see how nervous she got when you mentioned Uncle Marcus's name? I saw more than that. Did you notice how she typed without looking at the keyboard? That girl's been entering false information so long it's become automatic. Back at Dorothy's house, they spread their evidence across the dining room table. Robert had captured images of the equipment, the patient charts, and the receptionist's reaction to Marcus's name. Dorothy had memorized the layout of the facility and noted several discrepancies between what she'd seen and what was advertised online. The real question, Robert said, is who's behind Pinnacle Health Management? That's the company that owns Complete Care. Dorothy was already reaching for her phone. I know someone who might be able to help with that. Evelyn Hutchins had been Dorothy's sorority sister at Spelman College 50 years earlier and now served as a senior investigator for the Georgia Department of Insurance. They'd maintained their friendship through decades of family gatherings, church events, and the occasional crisis that required Evelyn's professional expertise. Dorothy Williams. Evelyn's voice crackled through the phone. Please tell me you're not calling because someone's trying to cheat you out of your insurance money. Close enough. Evelyn, I need a favor and it involves Medicare fraud. 20 minutes later, Evelyn had agreed to meet them that evening at Dorothy's house. She arrived carrying a briefcase and wearing the expression of someone who'd seen too much corruption in her 30-year career. Dorothy, what you're describing fits a pattern we've been tracking for months, Evelyn said, spreading her own documents across the table. Pinnacle Health Management owns 6 facilities across Metro Atlanta, all opened within the past year. They're billing Medicare millions of dollars for services to patients who are either dead or have never visited their facilities. How is that possible? They have access to real Medicare data names, social security numbers, medical histories, insurance information. Someone on the inside is feeding them this information. Robert looked up from his notes. Any idea who? Evelyn's expression darkened. We suspect it's someone high up in the Medicare processing center downtown, but proving it requires catching them in the act. Dorothy felt the familiar surge of determination that had carried her through 7 decades of challenges. What would that take? Ideally, someone would need to pose as a Medicare beneficiary and document the entire fraud process from beginning to end. But Dorothy, that would be dangerous. If they discover what you're doing— Evelyn, Dorothy interrupted, they're already stealing from my dead husband. They're stealing from families all over Atlanta who don't have the resources to fight back. I've been underestimated my whole life because of my age and my race. This time I'm going to use that to my advantage. Robert and Evelyn exchanged glances. They both recognized the steel in Dorothy's voice, the same tone she'd used 50 years earlier when she'd integrated the county courthouse as its first black secretary, and again when she'd faced down the HOA president who'd tried to prevent Marcus from planting a garden in their front yard. "What do you need from us?" Evelyn asked quietly. Dorothy smiled, and for a moment she looked like the young woman who'd marched with Dr. King and refused to back down from any challenge. "I need you to help me become the perfect Medicare fraud victim. And then I need you to help me make sure these thieves never steal from another family again." The investigation was about to become a carefully orchestrated trap. Dorothy's kitchen table had been transformed into a war room. Spread across its surface were Medicare forms, fake medical records, surveillance photos, and a detailed floor plan of the complete care facility that Robert had sketched from memory. The morning sun streamed through her lace curtains, illuminating the evidence of her growing campaign against the fraud ring. Evelyn Hutchins sat across from her reading glasses perched on her nose as she reviewed a thick stack of official documents. "Dorothy, I've created a complete false medical history for you under the name Dorothy Jefferson. According to these records, you've had recent knee surgery and require extensive physical therapy." "Jefferson was my grandmother's name," Dorothy said approvingly. "She'd get a kick out of knowing I'm using it to catch some thieves." Robert looked up from his laptop, where he'd been researching Pinnacle Health Management's corporate structure. "I found something interesting. Pinnacle's registered agent is listed as David Chen, but when I cross-reference that name with Medicare contractor databases, it comes up as an alias. The real owner appears to be someone named Michelle Thornton." "Michelle Thornton," Evelyn repeated, frowning. "That name sounds familiar." She pulled out her phone and scrolled through her contacts. "I knew it." Michelle Thornton used to work for CMS, the Centers for Medicare and Medicaid Services. She was fired 3 years ago for suspected data theft, but they couldn't prove anything. Dorothy felt a cold satisfaction settle in her chest. So she's using her inside knowledge to steal from people like Marcus. "It's worse than that," Evelyn continued. "If she still has contacts inside CMS, she could be accessing real-time Medicare data for hundreds of thousands of beneficiaries. This operation could be bilking millions of dollars from the system." The plan they developed over the next 2 hours was elegant in its simplicity. Dorothy would return to complete care rehabilitation as Dorothy Jefferson, a recent widow whose late husband had left her substantial life insurance money. She would be the perfect victim, elderly, recently bereaved, trusting, and wealthy enough to make the fraud worthwhile. "The key," Evelyn explained, "is to make them think you're vulnerable and isolated. No family to ask questions, no one to notice if strange charges appear on your Medicare statements." "That part won't be hard to act," Dorothy said with a bitter smile. "After Marcus died, that's exactly how I felt." Robert would pose as a freelance journalist, researching healthcare options for seniors, giving him legitimate reasons to visit the facility and document their operations. Evelyn would monitor the situation from her office, ready to coordinate with federal investigators when they had enough evidence. The most crucial element was the wire. Dorothy would wear a tiny recording device that Evelyn had obtained through her insurance investigation unit. It would capture every conversation, every fraudulent claim, every piece of evidence they needed to bring down the operation. "Dorothy, are you sure about this?" Robert asked for the 3rd time. "If they suspect what you're doing—" "Robert, baby, I've been dealing with people who underestimate me my entire life. White folks who thought I was too uppity. Black folks who thought I was too old-fashioned, men who thought I was too emotional. But you know what I learned. Sometimes being underestimated is the greatest weapon you can have. That afternoon, Dorothy practiced her performance in front of her bedroom mirror. She perfected the slight tremor in her voice that would suggest fragility, the hesitant movements that would imply confusion, the trusting smile that would make her seem like easy prey. It was a masterclass in protective camouflage skills she'd developed over decades of navigating a world that often saw her as less than she was. Wednesday morning found Dorothy back at Complete Care Rehabilitation, this time dressed in her most conservative outfit, a gray cardigan, sensible shoes, and minimal makeup that made her look older and more vulnerable than her 73 years. The recording device sat snug against her chest, hidden beneath a modest blouse. Mrs. Jefferson. The receptionist who'd introduced herself as Angela greeted her with practiced warmth. "How are you feeling today?" "Oh, much better, dear. Though I have to admit, all this paperwork is quite overwhelming. Since my husband passed, I just don't understand these insurance matters the way I used to." Angela's eyes lit up with what Dorothy recognized as predatory interest. "Don't you worry about that, Mrs. Jefferson. We handle everything for our patients. You just focus on getting better." Dorothy was led to a treatment room where a young man in scrubs introduced himself as Marcus, a name that sent a chill through her, though she kept her expression pleasantly confused. "Now, Mrs. Jefferson, I see from your chart that you've had some knee problems. Let's start with some gentle exercises." For the next 30 minutes, Dorothy endured a legitimate but unnecessary physical therapy session, while Marcus asked seemingly innocent questions about her living situation, her family, her finances. Each question was designed to confirm that she was the perfect victim, isolated, trusting, and financially comfortable. "Do you live alone now?" Marcus asked as he guided her through some simple stretches. "Yes, it's just me in that big house. My husband left me well provided for, thank the Lord. But sometimes I wonder if I should sell it. It feels so empty now." "Any children nearby to help you with decisions like that?" Dorothy shook her head sadly. "My daughter lives in California. We talk on the phone, but she has her own life, you know. I don't like to burden her with my problems." She could see Marcus making mental notes, filing away each piece of information that confirmed her vulnerability. By the time the session ended, Dorothy was certain they'd decided she was worth pursuing. "Mrs. Jefferson," Angela said as Dorothy prepared to leave, "I've been thinking about your situation. We have some additional services that might be helpful for someone in your circumstances. Would you be interested in hearing about them?" "What kind of services, dear?" "Well, we work with some financial advisors who specialize in helping widows manage their Medicare benefits and life insurance proceeds. Sometimes there are ways to maximize your healthcare coverage that most people don't know about." Dorothy's blood chilled, but she maintained her innocent expression. "That sounds wonderful. My husband always handled our finances, and I'm afraid I'm quite lost when it comes to such matters. Let me set up a consultation for you with one of our specialists. How does Friday sound?" As Dorothy agreed to the appointment, she felt the wire recording every word of the conversation. They were walking directly into her trap, confident that they'd found another easy mark. That evening, Dorothy sat in her living room with Robert and Evelyn reviewing the day's recording. The conversation with Angela and Marcus had been captured with crystal clarity, including their obvious attempts to identify her as a potential victim. "They're definitely planning something bigger than just fake physical therapy charges," Evelyn observed. "This consultation they're setting up, that's probably where they'll try to get access to your bank accounts or investment information." Robert was pacing the room, his journalist instincts firing on all cylinders. "Aunt Dorothy, this is huge. We're not just looking at Medicare fraud anymore. This sounds like a comprehensive elder abuse operation. Healthcare fraud, identity theft, financial exploitation, maybe more." Dorothy nodded grimly. "Which means there are probably dozens of victims, maybe hundreds. People like me who trusted the wrong people and lost everything. The question is, Evelyn said, "How do we make sure we get everyone involved if we move too soon? We might only catch the small fish while the people running the operation escape." Dorothy stood and walked to the mantelpiece where a photograph of Marcus in his army uniform watched over the room. She thought about the 48 years they'd spent building their life together, the sacrifices they'd made, the dreams they'd shared. She thought about other families who might be facing the same violation of trust and memory that she'd experienced. "We get them all," she said simply. "We let them think they're reeling in the catch of their lives, and then we make sure they face justice for every person they've hurt." Evelyn smiled with the satisfaction of someone who'd spent 3 decades watching criminals underestimate the very people they sought to victimize. "Dorothy, I think you're about to become the most expensive mistake Pinnacle Health Management ever made." Friday's appointment couldn't come soon enough. Dorothy was ready to walk into the lion's den armed with hidden cameras, recording equipment, and 73 years of experience in surviving people who thought they were smarter than she was. The trap was set. Now it was time to spring it. Friday afternoon arrived with the kind of oppressive Atlanta humidity that made everything feel thick and heavy. Dorothy sat in her car outside Complete Care Rehabilitation, checking her appearance one final time in the rearview mirror. The hidden camera in her purse was recording. The wire beneath her blouse was transmitting clearly to Robert's surveillance van parked across the street, and Evelyn was standing by with federal investigators who would move in once they had enough evidence. Dorothy had dressed for this final performance with the same care she'd once brought to job interviews in a world that didn't want to hire Black women. Conservative navy dress, modest jewelry, and the slightly bewildered expression of a widow out of her depth. But beneath that carefully constructed facade, her mind was sharp as a blade. "Mrs. Jefferson." Angela greeted her with the kind of effusive warmth that Dorothy now recognized as completely artificial. "I'm so excited for you to meet our financial specialist. She's going to be able to help you in ways you never imagined." Dorothy was led to a back office she hadn't seen during her previous visits. The room was expensively furnished with a mahogany desk, leather chairs, and diplomas on the wall that Dorothy suspected were as fake as everything else about this operation. Behind the desk sat a woman in her 40s with platinum blonde hair and a power suit that probably cost more than Dorothy's monthly Social Security check. "Mrs. Jefferson, I'm Michelle Thornton, Senior Benefits Coordinator for Pinnacle Health Management. Please have a seat." Dorothy's pulse quickened. This was the woman Evelyn had identified as the mastermind, the former CMS employee who was using her inside knowledge to orchestrate this fraud. Dorothy settled into her chair, projecting the helpless confusion that had gotten her this far. "Now, Mrs. Jefferson," Michelle began, her voice smooth as silk. "Angela tells me you're recently widowed and struggling to manage your late husband's affairs. I want you to know that you've come to the right place. We specialize in helping women like you maximize their benefits and protect their assets." "Oh, that sounds wonderful," Dorothy replied, allowing a slight tremor to enter her voice. "I'm afraid I'm quite overwhelmed by all of this. My husband Harold always handled our finances." Michelle's eyes gleamed with predatory interest. "Of course he did. That's very common with women of your generation. But don't worry, we're going to take excellent care of you. Now I see from your intake forms that Harold left you quite well provided for. Life insurance savings investments." Dorothy nodded hesitantly. "Yes, he was very careful about such things. But I don't really understand how it all works." "That's exactly why you need our services. You see, Mrs. Jefferson, there are ways to structure your Medicare benefits and financial assets that can save you thousands of dollars in healthcare costs while protecting your inheritance from taxes and government claims." What followed was a masterfully delivered pitch that would have sounded legitimate to anyone who didn't understand how Medicare actually worked. Michelle explained how Dorothy could optimize her benefits by transferring certain assets to Pinnacle Health Management's trust accounts, which would supposedly shield her money while ensuring she received premium healthcare services. "But won't Medicare question these arrangements?" Dorothy asked, playing the part of the concerned but confused widow. Michelle leaned forward with a conspiratorial smile. Mrs. Jefferson, I used to work for the Centers for Medicare and Medicaid Services. I know exactly how to structure these arrangements so they appear completely legitimate. The government will never know the difference. Dorothy felt a surge of cold satisfaction. Michelle had just admitted on tape to using insider knowledge to defraud Medicare, a federal crime that would put her away for years. Now, Michelle continued, I'll need you to sign some paperwork giving us power of attorney over your healthcare decisions and financial assets. This is purely for administrative purposes, you understand. You'll maintain complete control over your money. Dorothy pretended to read through the documents Michelle placed before her, though her trained eye immediately spotted the language that would give Pinnacle complete access to her bank accounts, investment portfolios, and Medicare benefits. This wasn't just fraud, it was financial kidnapping. This all looks very complicated, Dorothy said, maintaining her helpless act. Are you sure this is legal? Mrs. Jefferson. Michelle's voice took on a slightly sharper edge. I've been doing this for years. Trust me when I say that sophisticated financial planning often appears complicated to people who aren't familiar with these systems. But I guarantee you everything we're doing is completely above board. Another lie captured on tape. Dorothy could practically hear the prison doors slamming shut on this woman. Well, Dorothy said slowly, if you're certain it's all legitimate. She reached for the pen Michelle offered, then paused. Oh dear, I'm afraid I've forgotten my reading glasses. Could you perhaps explain exactly what I'm signing? Michelle's professional mask slipped slightly, revealing the impatience beneath. Of course. This first document gives us medical power of attorney, allowing us to coordinate your healthcare and Medicare claims. This second one establishes a trust account for your assets, protecting them from potential government seizure. And this final document authorizes us to act as your financial representatives with Medicare and other agencies. Dorothy nodded, as if each explanation clarified everything, while mentally cataloging every fraudulent claim for the federal prosecutors who would eventually hear these recordings. You know, Dorothy said suddenly, this reminds me of something that happened to my friend Gladys. She signed some papers like this and ended up losing her house. But I'm sure that was completely different. Michelle's smile became strained. Mrs. Jefferson, I can assure you that what happened to your friend has nothing to do with our services. We're a fully licensed healthcare management company with an impeccable reputation. Oh, I'm sure you're right, Dorothy replied. It's just that Gladys mentioned the company was called something like Pinnacle too, but that couldn't be the same company, could it? The color drained from Michelle's face. What was your friend's full name? Gladys Washington. Sweet lady lived over in Decatur. She passed away just last month, poor thing. Her family said the strangest things happened with her Medicare after she died. Charges for treatments she never received, bills for services at facilities she'd never visited. But I'm sure that was just some computer error. Michelle was no longer pretending to smile. Mrs. Jefferson, I think there may have been some misunderstanding about our services. Perhaps you should take these documents home and review them with a family member before making any decisions. Dorothy could see the panic in the woman's eyes. Michelle had realized that Dorothy Jefferson knew far more than she was letting on, and that this sweet, confused widow might be something else entirely. Oh, no, dear, Dorothy said, her voice still trembling, but her eyes suddenly sharp as steel. I think I understand your services perfectly. She reached into her purse and pulled out a thick folder, placing it on Michelle's desk with deliberate care. You see, I've been documenting your operation for weeks. Every fraudulent claim, every stolen identity, every family you've victimized. Michelle's professional facade crumbled completely. I don't know what you think you're doing, but what I'm doing, Dorothy interrupted her voice, now carrying the full authority of her 73 years, is making sure you never steal from another grieving family. You took my husband's name, his Medicare number, his memory, and you used them to line your pockets. You thought I was just another helpless old black woman you could manipulate and abandon." Dorothy stood, her bearing transformed from confused victim to avenging angel. "But you made one crucial mistake, Michelle. You underestimated exactly what this old black woman is capable of when someone threatens her family." Michelle lunged for her phone, but Dorothy was already opening her purse. "I wouldn't bother calling security, dear. By now, federal agents are probably walking through your front door." As if summoned by her words, the sound of official voices echoed from the facility's main entrance. "Federal agents, nobody move." Michelle's face went white as she realized the scope of what was happening. "You can't do this. We have rights." "So did my husband," Dorothy replied coldly. "So did every person whose identity you stole, every family whose grief you exploited, every elderly person you taught to distrust the healthcare system they'd paid into their entire lives." The office door burst open, revealing Detective Santos Evelyn and two federal agents in bulletproof vests. "Michelle Thornton," Detective Santos announced, "you're under arrest for Medicare fraud, elder abuse, identity theft, and conspiracy to commit financial crimes against the elderly." As the handcuffs clicked around Michelle's wrists, Dorothy felt a profound satisfaction settle in her chest. The woman who had stolen from her husband's memory was finally facing justice. But the victory felt incomplete. There were still other victims to vindicate, other families who deserved to know the truth about what had been done to them. 3 months later, Dorothy Williams stood before the packed auditorium of the Fulton County Senior Center, facing an audience of elderly black faces that reflected both pain and hope. The morning sun streamed through tall windows, illuminating a room filled with people who had come to hear her story and to share their own. "My name is Dorothy Williams," she began, her voice carrying clearly to the back of the room, "and I'm here to tell you about the day I decided to stop being a victim and start being a warrior." The federal investigation that had grown from Dorothy's undercover work had uncovered a fraud ring that stretched across 6 states, with Pinnacle Health Management at its center. Michelle Thornton and her associates had stolen over $12 million from Medicare by billing for services to dead patients, creating fake treatment records, and exploiting the trust of grieving families. But the numbers only told part of the story. In the audience sat Mrs. Gladys Harper, whose late husband's Medicare account had been used to bill for phantom chemotherapy treatments. Behind her sat James Morrison, who'd discovered his deceased wife's identity being used for elaborate physical therapy sessions she'd never received. Row after row of faces representing families who'd been violated in their most vulnerable moments. "They counted on our silence," Dorothy continued, gesturing to encompass the entire audience. "They counted on our shame, our confusion, our willingness to accept whatever the computer said because we're supposed to trust the system. But what they didn't count on was our community." The investigation had revealed that Pinnacle's victims were overwhelmingly elderly African Americans, a demographic the criminals had specifically targeted because, as one internal email had put it, they were less likely to have family members monitoring their accounts and more trusting of authority figures. Robert Williams Jefferson, as he now signed his bylines, had won a Pulitzer Prize nomination for his series Exposing the Fraud. But more importantly, his reporting had led to congressional hearings on Medicare security and the passage of the Elder Identity Protection Act, which required additional verification before Medicare benefits could be transferred or modified after a beneficiary's death. Evelyn Hutchins had been promoted to Director of Elder Fraud Prevention for the state of Georgia, a position created specifically to address the systemic vulnerabilities that Pinnacle had exploited. Her office now maintained a hotline where families could report suspicious Medicare activity with dedicated investigators trained to recognize the patterns of organized fraud. "But justice isn't just about punishment," Dorothy told her audience. "It's about prevention. It's about making sure no other family has to go through what we went through." She gestured to a table at the front of the room, where volunteers from the AARP Fraud Watch Network were distributing information packets. Today, you're going to learn how to protect yourselves and your families. You're going to learn how to read your Medicare statements, how to spot suspicious charges, and most importantly, how to fight back when something isn't right. After her presentation, Dorothy worked the room like the experienced community organizer she'd become, shaking hands, taking notes, and listening to stories that broke her heart, even as they strengthened her resolve. Mrs. Harper approached with tears in her eyes. "Mrs. Williams, I never thought I'd see justice for what they did to my Samuel's name. Thank you for being brave enough to fight." Dorothy squeezed the woman's hand. "Mrs. Harper, we all have to be brave. That's the only way we protect the next generation." As the crowd dispersed, Dorothy found herself standing in the empty auditorium with Jerome and Keisha, who had become fierce advocates for elder fraud prevention in their own right. Jerome's software engineering skills had proven invaluable in helping other families track down fraudulent charges, while Keisha's background in social work had made her a natural counselor for victims struggling with the emotional aftermath of betrayal. "Mama," Jerome said, using the name he'd called her since childhood, "Daddy would be so proud of what you've accomplished." Dorothy nodded, feeling Marcus's presence in a way she hadn't since the early days after his death. "Your father always said that when somebody knocks you down, you get up and you make sure they can't knock down anybody else. I think we've honored that." The Marcus Williams Memorial Fund, established with the settlement money from the class action lawsuit against Pinnacle, now provided free legal assistance to elderly fraud victims and funded community education programs across the Southeast. Dorothy served as its board chair, bringing the same meticulous attention to detail that Marcus had once applied to his postal service roots. Her house had been transformed as well. The spare bedroom that had once stored Marcus's collection of vintage postal uniforms now served as an office where Dorothy coordinated with law enforcement agencies, victims' advocacy groups, and congressional staffers working on elder protection legislation. But the most meaningful change was in Dorothy herself. The woman who had once felt invisible in her grief had discovered a voice that carried across courtrooms, congressional hearing rooms, and community centers. The pain of Marcus's loss would never fully heal, but it had been transformed into a powerful force for protecting others. On Sunday mornings, Dorothy still attended Mount Olive Baptist Church, but now she was frequently asked to speak about her experiences. Her testimony had inspired the church to create an elder protection ministry where younger members helped seniors navigate everything from Medicare enrollment to online banking security. "The Bible tells us that weeping may endure for a night, but joy cometh in the morning," she had told the congregation the previous Sunday. "I want you to know that joy doesn't mean forgetting your pain. It means using that pain to serve a purpose greater than yourself." As Dorothy drove home through the familiar streets of her Atlanta neighborhood, she thought about the journey that had brought her from that first suspicious Medicare notification to this moment of hard-won peace. The house still felt too big sometimes, and she still set two places at the table from force of habit, but it no longer felt like a monument to loss. Instead, it had become a headquarters for hope, a place where other families found the resources and support they needed to fight back against those who would exploit their vulnerability. Her phone buzzed with a text from Detective Santos. "Another fraud ring broken up in Birmingham using your playbook. 6 arrests, $3.2 million recovered. You started something big, Mrs. Williams." Dorothy smiled as she pulled into her driveway. Tomorrow, she would call the Birmingham victims' families. She would listen to their stories, help them navigate the legal system, and remind them that they were not alone. Because that's what warriors do. They protect their community. They pass on their knowledge, and they make sure that no one has to face the battle alone. The sun was setting over Atlanta, painting the sky in shades of gold and purple. Dorothy Williams, 73 years old and still fighting, walked up the steps to her front porch where Marcus's rocking chair sat empty but no longer lonely. Justice had been served. The work continued. And somewhere in heaven, she was certain that Marcus was smiling with pride at the woman he'd loved for 48 years, the woman who had proven that being underestimated was sometimes the greatest weapon of all. Dorothy Williams had found her way home to herself, and in doing so, she had helped dozens of other families find their way to justice. The war against elder fraud was far from over, but now it had a general who knew exactly how to win.